Depression by Ashley Green. Depression, the overview. The word depression is often used to describe many different feelings. A sense of hopelessness, loss of interest, often connected with loneliness, and insecurity. For some, a fleeting mood, for others, an outward appearance of sadness, and for others still, a strong, diagnosable clinical disorder. Every year, millions of adults are diagnosed with this disease. They suffer through mood changes that often affect personal, vocational, social, and health functioning. The symptoms of depression: fatigue or loss of energy most days, feelings of worthlessness or guilt, impaired concentration, indecisiveness, insomnia or hypersomnia, excessive sleeping, markedly diminished interest in almost all activities nearly every day called anhedonia, restlessness or feeling bogged down, recurring thoughts of death or suicide, significant weight loss or gain, a change of more than 5% of the body weight in a month. The triggers of major depression: grief from losing loved ones through death, divorce, or separation, social isolation or feeling of being deprived, possibly a feeling of not belonging, major life changes, moving, pregnancy, graduation, job change, retirement, personal conflicts in relationships, either with a significant other or a superior, physical, sexual, or emotional abuse. Other likely risk factors for depression include past alcohol dependence, insecure attachment to parents in early adolescence, and the experience of abuse or neglect in childhood. Possible risk factors for depression include cannabis use, low birth weight, high levels of television viewing and media exposure in adolescence, and head injury. Treatments of major depression. Antidepressants can promptly help symptoms. With more chronic cases of psychological treatment or advanced psychotherapy is necessary to help patients regain normal function of their lives. Of depressed people who receive combination treatment, both antidepressants and psychological treatment simultaneously, 80 to 85% become symptom-free. Depression medication includes Zoloft, Lexapro, Prozac, Paxil, Celexa, Effexor, Cymbalta, and MAOI. Who is at risk for depression? Major depression affects 6.7% of the U.S. population over the age of 18. Between 20 and 25% of adults may suffer an episode of major depression at some point during their lifetime. Major depression affects older adults, teens, children, but frequently goes undiagnosed and untreated in these populations. Almost twice as many men as men have major or clinical depression. Hormonal changes during puberty, menstruation, pregnancy, miscarriage, and menopause may increase the risk. Other risks include increased stress at home or work, balancing family life with a career, caring for an aging parent, or raising a child alone. Signs of depression in men. Depression in men is definitely underreported. Men who suffer from clinical depression are often less likely to seek help or even talk about their troubles. Signs in men may include irritability, anger, or drug and alcohol abuse. Repressing their feelings can result in violent behavior directed both inwardly and outwardly. It can also result in an increase in illness, suicide, and homicide. Regions of the brain that affect mood. Amygdala. The amygdala is a part of the limbic system, the group of structures deep in the brain that are associated with emotions such as anger, pleasure, sorrow, fear, and sexual arousal. Thalamus. The thalamus receives most sensory information and relays it to the appropriate part of the cerebral cortex, which directs high-level functions such as speech, behavioral reactions, movement, thinking, and learning, connected to bipolar disorder. Hippocampus. The hippocampus is part of the limbic system and has a central role in processing long-term memory and recollection. It is part of the brain that registers fear when you are confronted by a barking, aggressive dog, and the memory of such an experience may make you wary of dogs you come across later in life. The hippocampus is smaller in some depressed people, and research suggests that ongoing exposure to stress hormones impairs the growth of nerve cells in this part of the brain. Shown are PET scans of the brain showing different activity levels in a person with depression compared to a person without depression. The depressed person is on the left, the not depressed person is on the right. How to self-help with depression. Try to be active and exercise, get back into what you love. Set realistic goals, something that's easily achievable. Set some priorities to do and do what you can as you can. Break up large tasks into smaller ones. Try not to isolate yourself. Let others help you. Expect mood to improve gradually, not immediately. Do not expect to suddenly snap out of your depression. Often during treatment for depression, sleep and appetite will begin to improve before your depressed mood afflicts. And here are my references. Thank you for listening.